So let's move on and postpone the questions to the joint discussion time, which is after the next two talks. So we have another short presentation now by Kostas Kavoussanakis about a very interesting new initiative in the UK. I think we already tried to convince them to give a talk in our first ELLIS workshop, but I think Kostas said they just want to make a bit more progress. So we're very happy that this time he's going to tell us about RAMP.
Okay, so am I coming through? Yeah. So RAMP is the Rapid Assistance modeling the pandemic initiative that was convened by the Royal Society in the UK. And the aim was to work with already running COVID-19 initiatives. And we had our target list. There is this scientific pandemic influenza group on modeling that does modeling work on COVID-19 just now. And that feeds into the scientific advisory group on emergencies, and that feeds into the government, the Civil Contingencies Committee of the government. And these are all UK bodies that the Royal Society had access to. And the idea was to put together a RAMP that would fit directly into working groups of SPIEM and also of SAGE. So it looked pretty simple what we were wanting to do. And so what we did was we set up a survey for less than a week. We thought we were going to get about 100 responses or something like that. We got 1,800 responses. And 50% of these are from groups. So it's not like we have 1,800 volunteers. We have a significantly higher number, and quantifying and qualifying what it is we've got is an ongoing, and it seems interminable task, as more people want to join all the time, despite the survey being closed. As I said before, our first target was this SPIEM group, and we did make 70 of our volunteers available to 24 SPIEM groups, and we are also aware of at least one preprint, one output that is directly relevant to the SPIEM groups, and that has been fostered by RAMP. So this is already a good point. And the other thing we did, because now obviously we are expanding well beyond the original thinking, we identified a number of pre-existing collaborations that are working on developing fundamental human epidemic models with the aim of adding more resource as they need it, more relevant resource as they need it. Another area which is interesting, and we started going on that, is looking into urban analytics and social modeling. And the idea there is to create new epidemic models that have the social interactions at the forefront and as fundamental part of what it is that they're doing. And what we obviously want to do is to look how human behavior needs to be taken into account when modeling the epidemic. And then something that we always wanted to do is to try and help with the deluge of preprints and publications that are coming out in terms of COVID-19 modeling and intervention. So what we're trying to do is to put together a leadership team and an infrastructure and the processes, of course. So we would allow people to get questions directly from the SPIEM groups and be able to quickly peer review and provide a feedback service to what it is that they're outputting. As I said, we also want to look at what's going out in general. And we also want to see what other people in our community see. So we're trying to crowdsource the procedure of nominating outputs, be they from RAMP or from anywhere actually, and involving the RAMP volunteers to look into these and assess them, and then try and figure out what is more worthwhile. So what is it that we're doing now and next? So one of the new topics for us is fluid dynamics of aerosols and how they work with within small buildings and confined spaces, and how that would work. And we're trying to add to such initiatives. There is also a new line for us, which is looking at how the virus acts when individuals already carry the infection. and trying to understand what happens, the time evolution of this, who are more likely to get it, who are more likely to get it and suffer badly, etc. Another one is we're trying to see what it is that we should be looking at, which would really inform policy making. And we're taking advice from SPIEM and SAGE about this. Obviously, this is very UK-based, what I'm describing here. And the other thing that we're doing is continuation or an extension, putting together a program for discussion groups and also webinars with invited participants. And the participants would be from organizations already running, but also from qualified people who are in the RAMP volunteer base. And the idea here is to create live and recorded presentations that would be pedagogic. They would help people get up to scratch with what it is that we're handling here and perhaps contribute better from that position. And the final thing that I wanted to raise is that we're working with other initiatives in one form or another. And the breadth here is quite wide. So we have DELV, which does inferential modeling of disease. We have COVID, which is looking at logistics, etc., to do with how the patients are affected by issues with logistics. ENCORN is operational research. HEC Biosim is molecular modeling. There is also an actuarial response group. UKRI, which is the UK's research councils, effectively are coordinating some R&D work. There's a lot going on, and we're trying to stay on top of that. And with this, I'd like to thank you all for attending this, and especially the organizing committee for giving me the opportunity.